Good morning. My name's Olivia K. I'm known as Olivia K on Facebook, Ollie K on Facebook, and WarmEM 9800 on Reddit. I mostly talk about nursing related content that can help you for your next NCLEX or while you're in nursing school, that's going to help you through nursing school. I have like playlists of fundamental videos, which I'm probably going to redo in the future, hopefully near future. But I'm often busy and I work almost every single day. I have a playlist for the med surge, comparing and contrasting different diagnoses, processes. That's probably going to help you with the case studies, the NGN style questions. So those will be helpful for you. The pharmacology playlist. I'm currently working on the maternity newborn playlist right now. So today I'm going to talk about the diagnoses and different disease processes that can occur with pregnancy, like the different complications. And if you get bored of my nursing related material, I do have a playlist for documentaries, which is fun. Recommend me any kind of documentary. Like my handles are there on my descriptions for a reason. So that way you can message me and be like, hey, I think you would like this documentary. Whether it's true crime or not, I wouldn't give a shit. Like anything. Then if you get bored of that, I have a playlist of reality TV shows and a separate playlist for Love is Blind. I'm going to create a different playlist for the ultimatum. I just finished up season 4, so I've covered that like in a few weeks. So I'm going to cover the ultimatum season 2 this week. Then I'm going to get to season 3 next week, and then after that season 4. So I don't want to just jump the gun and kind of do this like in a chronological kind of manner, because it's a lot. And then I do talk about thoughts and opinions or anything. I also review movies, so just let me know what to watch. And that's about it, right? So today is going to be the pregnancy complications. So this one's going to be a huge and big video because there's a lot to know. And this is high yield content, especially when, again, they're mostly doing like a lot of NGen, I keep saying NGen style case studies, questions. Because sometimes, especially if you're doing the RN one, they're going to do the pregnancy ones. I got a few pregnancy questions. And some of them, I knew a little bit. I was like, I'm not too sure. But it's a lot to know. But it's just good, the safest thing you can do with the pregnancy patients, okay? So I'm just going to go over the diagnosis process and the complications that can occur. Okay, so these are must to know, and a lot of these are highlighted and underlined. And if I tell you that underline or like star it, then I'm sorry, I thought I saw a bug. That's really important, and it's a good thing to note or put down, okay? So I'm going to start with this one, hyperemesis gravidarum, and I know I mentioned this before in my last video. So that's severe nausea, vomiting. It can cause dehydration, electrolyte imbalance, really, weight loss, and then there's ketones in urines. Treatment mostly is IV fluids, antiemetics, vitamin supplementation, and like I said in my last videos, carbohydrates like crackers, and you want to eat that first thing in the morning. So that's something for you to be aware of, okay? Then small frequent meals. So that's basically it, all right? So that's what I was saying in my last video. Like if there's increased vomiting, that's something the pregnant woman should be aware of and let the prescriber know, because could be hyperemesis gravidarum. Literally hyper, that's a lot, and emesis, that means vomiting. So that's that. Gestational diabetes, okay, that develops with pregnancy. So this is different. This is someone that may not be diabetic beforehand, right? Because the baby's developing, and it sometimes only happens with pregnancy. And of course, the body's going through the changes and whatnot, so which is why it can occur with just pregnancy, okay? So this will be screened between 24 to 28 weeks. Poor glucose control could cause fetal macrosomia. So that's when the baby is big, okay? Like they're over like 9 pounds, and that means they're they have all that glucose. Birth injury, preeclampsia, which we're going to get into, newborn hypoglycemia. So the treatment for this would be nutritional changes, glucose monitoring, and exercise when approved, and sometimes insulin. As a matter of fact, actually, they even have the glucose tolerance test. And I think that's the next video. We'll just get into that, where they have to take these sugary, yucky drinks or whatever the case, and they have to check whether they are diabetic or they may have gestational diabetes. So we'll get into that the next video. Then we have gestational hypertension. That's just high blood pressure over 20 weeks without proteinuria and then organ damage. So then now this is where I want you to like star, highlight, or underline, whatever the case, okay? Then there's preeclampsia, all right? So that's hypertension with protein in the urine. So proteinuria, meaning there's protein in the urine. Or signs of organ dysfunction. So this is the warning signs you must be aware of. So that's a severe headache. So watch out for that. Vision changes, big on the vision changes. Right upper quadrant or epigastric pain. Hyperreflexia, big one. So this is mostly like neurological. Decreased urine output or difficulty breathing. So what I just said, please definitely watch out for the protein in urine. Big thing. So when you're looking in labs, because they do give you labs, you'll see like +2 protein, and that's proteinuria, because there should not be any protein in your urine. There should be nothing really in that urine at all. Okay, then vision changes. So again, continue to start underline this part. So when we're talking about eclampsia or preeclampsia, magnesium sulfate is going to be given to prevent seizures in severe preeclampsia, which actually becomes eclampsia. That's eclampsia, but we're going to talk about next. So we're going to be monitoring for respiratory rate, deep tendon reflexes. That's a big one. Urine output and level of consciousness. A big star on that, on all that. Then what the nurse needs to really be careful when they're administering magnesium sulfate, because they can have magnesium toxicity, reflexes, respiratory depression. So once they even say with the parameters, I mean, I've never exactly worked in the maternity ward, but it's a big parameters when they're given the magnesium sulfate and it's the respiratory is like a 10, they need to give the calcium gluconate, which we're going to get to right now. Decreased urine output, calcium gluconate is the antidote. Okay, please pay attention to that part. Like, you can blank out anything else, like what I just said the past 3 minutes, but when it comes to the magnesium sulfate, preeclampsia and eclampsia, you have to pay attention to that part. Okay, so under respiratory under 12 or 10, I believe. They're mostly, every place is different, but mostly like under 12, they're going to want you to give the calcium gluconate, which I'm never personally give, because I'm not working that kind of environment. That's not for me. It's too stressful. I can do it. So then there's eclampsia, as I said, that's preeclampsia with seizures. That's not even preeclampsia, that's eclampsia period. That's when they have the seizures. So you need to turn the patient to her left side, protect the airway. This is any kind of seizure patient. That's what you should be doing. Administer oxygen in this case, because we're talking about baby in there. And no restraining. You never want to restrain anyone with that's a seizure patient to begin with anyway, and you need to make sure their airways are open or put anything in the mouth. That's the wrong thing to do, and if you do that, then what are you doing being a nurse, right? Don't do that. I've never seen that happen. I've only had one patient that used to have like seizures, and I used to make sure that she was like facing the other side. She didn't exactly go to chair, but or she didn't exactly go to the floor per se, but she would her eyes would roll a little bit, and she kind of had seizure. Then I had to make sure that she was safe, and then it will only last for maybe 5 to 10 seconds of that, and then it's like, oh, and I'm like, hey, are you okay, dear? And she was fine. She didn't remember any of that happening. Okay, so don't turn them to the side always, and make sure their airways open. Don't put anything in the mouth. That's just general. And in this case with preeclampsia patient, make sure you're administering the oxygen. Okay. So speaking of oxygen and magnesium and calcium gluconate needs to be nearby and at the bedside at all times. Okay, when we're talking about a preeclampsia patient or an eclampsia patient, period. Don't know ifs, ands, or buts. Okay. Next important thing we're going to talk about, HELP. HELLP. Please remember that. Okay, that's the HELP syndrome. Hemolysis, elevated liver enzymes, low platelet counts. And of course, this is something I saw in my NCLEX. So you're going to see something like that in your qbanks, or again in the NCLEX. You could see that because they're going to provide you the labs, and then they'll want you to know that. So symptoms will be right upper quadrant pain, nausea, headache, malaise. So this is an emergency. So please, what did I always say all the time? Do not delay treatment, ever, ever, ever. So just important for you all to know. Then we have placenta previa. So there's an easy way I later on had to understand the difference between abruptio and previa. So with previa, painless. The blood's going to be bright red. So if it's bright red, that means it's bright. It's just happening. So the placenta is covering the cervix or is nearby. So with both previa and abruptio, please do not perform vaginal examinations. That's you're going to get that wrong almost always every time. Do not do that for either. Okay. So you need to call for help. You need to position. I think with her you position her like that. I don't remember that part, but do not perform vaginal examination, I believe. With abruptio, it's painful. There's pain. And the blood is dark red because here's the thing. Here's the difference between previa and abruptio. The uterus and the abdomen will be board-like and firm. And then there's going to be frequent contractions. So this one, don't perform vaginal examination for either of these, okay? Abrupt, pain. So that's how I remember, because abrupt means now. It's happening right this second. Abrupt, really quick. And there's pain. So call the provider when any of this is happening. That's what you can do. That's the one good thing you need to do for this patient. Then we have ectopic pregnancy. That's when the egg is fertilized. The fertilized egg is actually rather implants outside the uterus because it should be inside. It's outside, and it's not going to develop. It's going to be really bad. This is an emergency. You need to get the doctor like immediately. Symptoms will include unilateral pain. So it's just one. Uni means one, right? So it's just the pelvic pain is going to be intense, and there's vaginal bleeding. There's referred shoulder pain, dizziness, hypotension, sudden severe abdomen pain. Okay, so please contact the provider immediately right now. This is an emergency. You need to get her ready to the ER. Hydatidiform molar pregnancy. I'm just going to keep it like that, okay? I don't know how to pronounce it correctly. So it's abnormal placental tissue growth. So the findings will be like vaginal bleeding, severe nausea, vomiting, unusually large uterus, high. That's another thing to exactly pay attention with labs. All right, they're going to tell you there's HCG, high HCG levels, absent fetal tones. Contact provider immediately. So after this occurs, pregnancy has to be avoided. Okay, so you need to get her ready for because these are emergencies, considered emergencies. Get them checked out. Get them not checked out. Get them ready to be examined by the provider immediately. Period. Preterm labor occurs before the 37 weeks. So remember how I told you about the age of viability? That's that could occur even around that time too, but mostly is before the 37 weeks. So 37 weeks would be full term. Okay, so signs would be, as I said in my last video, is regular contractions, pelvic pressure, lower back pain, abdominal cramps, fluid leakage, cervical changes, corticosteroids such as betamethasone, which we're going to talk about in another video. There's only like a few meds that you need to be aware of when it comes to maternity newborn. It's going to help with fetal lung maturity. So that's going to be important, and we're going to talk about it next. Then this is PROM. Okay, premature rupture of membrane. So that means the labor, the amniotic sac. I'm so weird with words. It's going to break before the labor. And if this is before 37 weeks, this is preterm premature rupture labor. So pre-PROM. Nurse will need to monitor temperature, fetal heart rate, fluid characteristics, signs of infections, and please, again, avoid unnecessary vaginal exam. So when that happens, like we'll talk about when the fetal sac is black fluid, so that's really bad because that's a sign of fetal distress going on. So we'll talk about that another time when that occurs. So the one takeaway for you guys, I need you guys to understand, is always watch for bleeding no matter what trimester the woman is in, and I wish I've said that the last time. Increase fluid discharge, so definitely look out, because that could mean PROM, what was I saying? Premature rupture of membranes, the amnio sac. That means the baby's ready to come out. Swelling to the face, as I mentioned before, swelling is not okay to the face. Like swelling to the ankles and the feet, yeah, that's normal. But to the face, that's you have to look for airways, so that's not supposed to happen. That's never okay. Blurred vision and headache. Of course, we're thinking preeclampsia or eclampsia, so don't delay treatment with any of those, okay? And that's all I have for today. So the next time we're going to go over, I think we should go over the meds for sure. There's some pharmacology, some meds, not all, but there's like a few meds you should be aware of with maternity. And then there's this thing called Category X, which they should never be given to pregnant women at all. So we'll go over those meds that are safe, that are not safe for pregnancy women. So I'll work on that next week. And that's about that. Anyways, have a wonderful rest of your day and enjoy. Take care. Bye.